Today we are talking about substance use disorder and the diagnostic criteria for substance use disorder according to DSM-V TR. So in essence, substance use disorder, it spans a wide variety of problems arising from substance use and cover 11 different criteria. So those criteria are actually intended to give clinicians, to give psychiatrists an important insight on how severe the condition really is. So the first important criterion is taking the substance in larger amounts or for longer period than you are meant to. For example, the patient plans to take the substance for only several minutes, and he ends up taking the substance for hours and hours. The second important criterion is wanting to cut down or stop using the substance but not managing to. So the patient really intends to cut down, he wants to cut it, however he is unable to do so. He doesn't have enough willpower or enough simply the substance is stronger than him, and he's unable to lower the dose or to cut it completely. The third important criterion is spending a lot of time using or recovering from the use of substance. So when the patient takes the substance, it takes a lot of time to recover, to return to his proper original functioning. The fourth important criterion is cravings and urges to use the substance. So whenever the patient is not using it, he has a very intense feeling of craving to use the substance. The fifth important criterion is not managing to do what you should at work, home, or school because of the substance use. That actually means that you are disregarding your obligations, either family obligations or educational obligations, because of the substance. The sixth criterion is continuing to use even if it causes problems in relationships. So the patient may, for example, break up with his girlfriend or her boyfriend, or may have a problem generally in forming and maintaining relationships because of the substance use. Also, a potential criterion is giving up important social, occupational, or recreational activities because of the substance use. So it's a relatively common thing, for example, for a drug addict, that before he started taking drugs, that he actually had a variety of different activities with his friends, related to his work, for example, or recreation, and now because of the substance use he is unwilling or unable to perform these activities. Also, the eighth criterion is using a substance again and again, even when it puts you in danger. For example, you have some obvious danger because of trying to get the substance or taking the substance, and you ignore it. The next criterion is continuing to use even when you know that you have a physical or psychological problem that could have been caused or made worse by the substance. For example, the alcoholic, he takes a lot of alcohol, despite the clear evidence that alcohol has already made significant damage to his liver, and he has clear evidence. For example, he went to do some biochemical analysis or some other analysis, and those analyses showed that his liver is damaged, but despite that fact, he is continuing to use the substance. The 10th criterion is needing more of the substance to get the effect that the patient wants. In other words, this is a tolerance. So tolerance means that every time, next time that you're taking the substance, the dose must be higher if you want to achieve the same effect that you had before. And the last criterion that, at least according to the DSM-V TR diagnostic manual, it's a development of withdrawal symptoms which can be revealed by taking more of the substance. So that withdrawal symptom or withdrawal syndrome is actually a very important diagnostic criterion that many, especially drug addicts, experience after continuous taking of the drugs. So these are only diagnostic criteria. A patient does not necessarily need to fulfill all those criteria. So generally these criteria are grouped into 4 primary categories that refer to physical dependence, risky use, social problems, and impaired control. So the main purpose of these diagnostic criteria is for research and for practice, in terms that it allows clinicians to specify how severe or how much of a problem the substance use disorder is, depending on how many symptoms it has identified.